Hello ladies and gentlemen, Mature Link here. Welcome to my next Let's Play. I would say it's going to be a surprise, but it's probably not, because if you saw my last Let's Play. That's right, as you saw there, my next Let's Play will be Trauma Center New Blood. This one actually has voice acting in it, so you won't have to hear my terrible attempt at voice acting, but I'll go ahead and get this started. As you see, I've beaten the game once already, so I kind of know what's going on here, but anyway, I'm going to name it my real name, if I can learn how to spell my real name, Chris, so yes, we want to start. This one actually has tutorial levels in it also, so I'm going to be doing those. If you saw my playthrough, or my Let's Play.
Alaska, the frigid northern extremity of America. Come April, the harsh winter begins to loosen its grip on the land. The seemingly endless nights grow shorter, day by day, and the frozen wilderness starts to thaw. In the heart of this majestic setting lies a small town not far from Fairbanks, whose weary inhabitants eagerly await the arrival of spring. Montgomery Memorial Hospital watches over the town like an old man, and in this remote hospital toil two doctors who are about to be swallowed by the jaws of fate.
Okay, so that was a prologue. As I was going to say before that happened, I will, if you saw my Let's Play of Second Opinion, pretty much know how this game is going to act. But for y'all who didn't, or for anybody who wants to learn how to play this game, I will be going over the operation pointers. So anyway, let's go ahead and start operation pointer number 1.
We will now begin the tutorial. I will explain the basic treatment of affected areas. There are 3 topics: incisions, suturing, and bandaging. This patient is a mannequin, but please perform the treatment as if it were a human patient. Now, let's begin the first topic, the incision. First, we will use the antibiotic gel to disinfect the area where we will make the incision. This gel is a multi-purpose salve that is used for disinfecting, clotting blood, and treating wounds. Please select the antibiotic gel now. Do you see the yellow guideline where the incision will be made? The sections disinfected by the antibiotic gel will turn from yellow to blue. Try and disinfect the guideline until it turns completely blue. Hold the A button and move the... We are now done disinfecting it. Next, we will use the scalpel to make an incision. Now, please move the pointer to the end of the guideline and press the A button. Hold the A button and move the pointer up. That is how to make an incision. Now, let's try it again. First, you must disinfect the area. Now, let's make the incision. The incision has been made. Before we move to suturing, let's try making another incision. This brings the incision tutorial to an end. Next is the suturing tutorial. Now, let's begin suturing. The tools used to suture a wound are a needle and thread. Please select the large incisions are closed by stitching them shut with the needle and thread. Hold the A button and make a large zigzag pattern with the pointer following the incision. This is the procedure to follow when suturing a wound. As you just saw, the needle and thread are used to suture open wounds. Now, let's try it again.
Alright, so go ahead and suture the thing. Did poorly.
Hold the A button and move the pointer in a zigzag pattern. The same procedure is used to close large lacerations as well as to close up the initial incision. Now, let's try it again one more time. That's the end of the suturing tutorial. Bandaging is next. This is the last part of the tutorial. Bandaging is a treatment done at the end of almost every operation. First, let's disinfect the sutured area with the antibiotic gel. This also stops the bleeding at the edge. Please select apply the antibiotic gel to the sutured area to treat the hemorrhaging. The sutured area has been disinfected. Now, pick up the bandage tape. The bandage is on the left side of the screen. Move the pointer over it and press the A button. Move the pointer to one end of the sutured area and hold down the A button. Then, move the pointer to the other end of the sutures and release the A button. Don't make the bandage too long or too short. Also, be careful of the angle you apply the bandage at.
Alright, so go ahead and bandage up
This
the
is how
wound.
you tape sutured incisions. This is the step you will use to finish an operation. Master it. Now, let's try it again. First, treat the hemorrhaging along the suture. The sutured area has been treated. Now, pick up the bandage and bandage up the sutured area. This is the last time. Let's try it without any hints. Bandaging complete. Well then, let's review. Perform the incision, suturing, and bandaging treatments that we practiced.
So this is pretty easy, so just
You've made the incision.
go ahead and do this
Now
real
to
quick,
suture it.
and then we will be done with this tutorial. Sorry if I'm being
Finally,
a little
bandage the
quiet, I
incision.
just want you to be able to hear what she's saying, so go ahead and bandage it up, and we are done.
All the basic actions have been completed. Great work. That's the end of the tutorial.
I did really poorly on that bandaging, but that's okay. That's okay. Alright. Let's go to Operation Pointers 2 now, and it's going to teach us how to use
Welcome to
the
tutorial.
syringe and other
This
things.
time, I'll show you something similar to an actual operation and explain the uses of certain tools. The tools that I will be explaining are the syringe, sutures, and forceps. First, select the syringe. The syringe is a tool used to inject different medicines. Right now, there are inflammations in view. Let's try injecting these inflammations with an anti-inflammatory. The anti-inflammatory is the blue bottle at the bottom of the screen. Move the pointer over to the bottle with the blue medicine in it and press the A button. Hold the A button to fill the syringe with medicine. Now move the pointer to an inflammation and press the A button. The inflammation has been treated. Please treat the other inflammations in the same way.
So all you have to do is just
Please
inject
the
them with that blue medicine without
into
messing
the
up.
inflammation.
My hand was shaking for some reason,
All the
maybe because
inflammations
I had
have
just
been
drinking
treated.
coffee. I don't know.
That is how you inject medicine. Lacerations have occurred in the operating area. Let's treat these lacerations next. To treat the lacerations, use the sutures. Now, so hold down the A button and move the pointer in a zigzag motion along the length of the laceration. Once you've sutured from one end of the laceration to the other, let go of the A button.
So just suturing is just like doing the open wound.
Please treat the other
When you,
lacerations in the same way.
When you cut them open, it's the same way as it showed last time. So
Just like closing an incision, a laceration is closed by using a zigzag motion along the wound. Let's continue and perform a treatment to remove shards of glass from a patient's body. To remove foreign objects from the area, use the forceps. Now select the forceps. Move the pointer over the glass shard and press both the A and B buttons at the same time. Keep holding both buttons and pull the shard out in the opposite direction than it is lodged in. After getting a hold on the glass shard, pull it. Now carry it if the glass shard has been extracted. Now remove all the other shards using the same method.
So now we're going to go ahead and remove the glass. Be very careful. For some reason,
Look at how it's entered
they
the
try to
room.
make it a lot more. They try to
out.
make it a lot more
All the
real
glass
here, to
shards
where it
have
kind of
been
shakes
extracted.
when you're trying
But
to
now there are
pull
wounds
them
left
out.
behind from where the glass had entered the body. Use the antibiotic gel to treat small wounds like these. Now, treat one of the small wounds with the antibiotic gel. The wounds have been treated. Let's practice what we've covered here once more.
So now we're just going to practice everything that we just learned. So use the anti-inflammatory to take care of
Make
these
sure to inject the medicine
inflammations.
directly into the inflammation. The
Be sure not to be
inflammations have
an
been
idiot
treated.
like I was doing.
Now, move on to the other areas.
Now we're going to close up the
All lacerations
lacerations
have been sutured.
and pull the glass out,
The glass
and
shards
then
have been
use the
removed.
antibiotic gel to
Don't
fix
forget
it.
to treat the wounds with the antibiotic gel. All the wounds have been treated. Treatment of all areas is now complete. Great work! That brings this tutorial to a close.
Alright, so we finished that operation pointer, so now we're about to soon move on to the actual game. So go ahead and let's start 1-1 in a remote town.
They're here! Hurry, Val! The patient's a 40-year-old male. He has a gash on his chest and he's losing blood fast. How is he injured? He ignored the tour guide's warning and picked a fight with a grizzly. His blood pressure's 70, his heart rate's 130, and he's lost consciousness.
Got it. Can you hear me? We're going to take you into the hospital. My name is Valerie Blaylock. I'll be treating you. Don't worry. You've been badly injured, but it's not hopeless. In fact, you're quite lucky that there are 2 skilled doctors in a remote place like this.
I've confirmed the patient's blood type and blood count, Dr. Vaughn.
Do we have enough blood on hand? If not, then make arrangements. Have Eric make a quick trip to the blood center. Now what about the x-rays?
It looks like he has 2 broken bones. We'll have to rebuild them. Nurse, have an ample supply of antibiotic gel ready.
It's hard to believe, but situations like this don't seem to faze me anymore. And here I thought I was gonna be able to kick back and enjoy the northern lights every night.
Oh, quit your whining.
Doctor, the patient's vitals are dropping.
All right, let's get down to business. I have dinner reservations.
Alright, so here we have Mr. Greg Reinhardt. His height is 68.5 inches. His weight is 154.3 pounds. Lacerations on the chest require suturing, and bone reconstruction will be necessary for the right forearm.
Let's begin the conference. The patient has suffered a large laceration extending from his right shoulder to his chest. He also has a compound fracture in his right arm. The bone fragments seem to be aggravating the surrounding tissue. There are 2 objectives in this operation. The first is to stop the bleeding and suture the wound. The second is to retrieve the bone fragments, reform them, and set them in place.
The blood won't be arriving for a while.
We don't have time to wait. We have to begin the procedure immediately.
I agree.
And for this one, we're going to be choosing Marcus. So you can choose whichever one you want, but I'm choosing Marcus. So let's go ahead.
Time is of the essence. Let's get started.
So in this game, you actually get to choose 2 different doctors. I'm going to be
Okay, let's begin the operation. The patient's vitals are low. Please use the syringe to stabilize them.
so I'm going to be
His
using
vitals have
each
been
one
stabilized. Begin treating the external wound. First, you'll
to
need
change
to
it
sew
up
the
some.
laceration
So
with the sutures. Begin suturing the remaining lacerate.
So far, so good.
I'm going to be using both doctors, so that way we get some
Suturing is complete, but there are still
different
some
things
small
going on
wounds
here,
left.
and
Please treat them with antibiotic gel.
it would be different. I
Takes
mean,
care
it,
of the external wounds. Let's move on to treating his arm.
Apply the antibiotic gel to the incision guideline to disinfect the area. The area has been disinfected.
It won't look any different. It'll just be the different doctors who are doing it, so it don't really matter which one you use. Just make sure.
Begin treating the fracture.
If you want to just use
retrieve all the bone fragments. Use the forceps to remove the fragments that are locked. Place the fragments on the first fragment.
If you only want to use one doctor, then you can. But here we got to remove the bones, as she said. So go ahead and move them out of the way. And then after we move the bone fragments, we will just have to use antibiotic gel to.
Looks like this bone is warped.
Let's see if we can reshape it with the forceps.
So we have to move the bone back into place without messing up like a moron. I don't know why I did that, but need to let it go right about there. There we go.
Twist your wrist to maneuver the fragment into the correct position.
So it's just like a jigsaw puzzle, which if you saw me try to do one like this in Second Opinion, then you know how poorly I am at doing jigsaw puzzles. So
that's not the correct location.
That's not where it goes.
Look at the shape of the bone fragment more carefully.
I tried figuring out, but it goes right about there. There we go. That one goes right there. There you go. Exactly. That's exactly what it's like, Marcus. Thank you. So we're almost done fixing this guy's arm, and as soon as we do, we just have to use the antibiotic gel to affix them in place.
Have been properly placed. Now, please use the antibiotic gel to affix.
That does it. Let's close them up.
Now suture it in the same manner as the laceration.
So now we're about done here. So
okay, we need to bandage the sutured incision. Use the antibiotic gel to stop the bleeding before
the bleeding stopped.
Apply the bandage from one end of the suture.
Alright, so we just gotta put the bandage and we are done with this operation. Yay, congratulations. Of course, chapter 1s are easy operations, so there shouldn't really be any issue with it. I know I didn't get a good score on this one, but that's because I was stopping to hear pretty much what they were saying. I could have got a better score.
Now, I don't know how you can remain so calm during an operation. I'll transfer the patient to room 3.
He'll need to remain here for about 5 days. Should I send a bill for a guided tour of Montgomery Memorial to his travel agent?
Good idea, but don't serve him anything fancy. We don't want him getting too comfortable.
I see that the operation went well.
It did. So when are they going to give us the key to the city? We are making Alaska safe for tourists, after all.
I'll take it from here. That is, if you don't mind stepping aside for an old-timer like me.
No, not at all. Just let me know if anything comes up. I'll be at Lucky's, enjoying some grilled salmon.
Well, I don't let my stomach call the shots, so I'd be happy to stay a little longer, sir.
That's quite all right, Dr. Blaylock. There's nothing more we can do for him for the time being.
So that's it with that one. Hopefully you'll enjoy this Let's Play, but next time we will be going on to the next operation pointer and 1-2 Montgomery Memorial. So until then, thank you for watching, everybody, and have a great day.